Hello viewers and welcome to our video on understanding and preventing strokes. Strokes are a serious medical condition that can have life-altering consequences, but with the right knowledge and action, we can take steps to mitigate the risks. In this video, we'll delve into what strokes are, how they affect the brain, medical problems that raise the risk, lifestyle changes to help prevent strokes, diagnosing a stroke, and treatment options for both ischemic and hemorrhagic strokes. What is a stroke? A stroke, often referred to as a brain attack, occurs when blood flow to a part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. This can happen due to a blockage that is ischemic stroke or the rupture of a blood vessel that is hemorrhagic stroke. Without prompt medical attention, brain cells begin to die within minutes, leading to potentially irreversible damage. How strokes affect the brain. When a stroke occurs, the affected part of the brain can no longer function properly. This can result in a range of symptoms, including weakness or paralysis on one side of the body, difficulty speaking or understanding speech, vision problems, severe headaches, and loss of balance or coordination. The specific symptoms experienced depend on the location and severity of the stroke. Medical problems that raise stroke risk. Certain medical conditions and lifestyle factors can increase the risk of stroke. These include high blood pressure, diabetes, high cholesterol, obesity, smoking, excessive alcohol consumption, and physical inactivity. Additionally, age, gender, race, and family history can also play a role in stroke risk. Lifestyle changes to help prevent strokes. 1. Maintaining a healthy diet. Emphasize fruits and vegetables. These are rich in vitamins, minerals, and antioxidants that support overall health and help reduce the risk of stroke. Choose whole grains. Opt for whole grains such as brown rice, whole wheat bread, and oats, which provide fiber and essential nutrients while helping to regulate blood sugar levels and lower cholesterol. Select lean proteins. Incorporate lean sources of protein such as poultry, fish, beans, and legumes into your diet, while limiting red meat and processed meats, which are high in saturated fats and sodium. Limit unhealthy fats and sugars. Minimize consumption of saturated fats found in fried foods, processed snacks, and fatty cuts of meat, as well as added sugars found in sugary beverages, desserts, and sweetened snacks. 2. Exercising regularly. Cardiovascular exercise. Engage in activities that elevate your heart rate and increase circulation, such as brisk walking, jogging, cycling, swimming, or dancing. Strength training. Incorporate resistance exercises using weights, resistance bands, or bodyweight exercises to build muscle mass, improve metabolism, and support overall cardiovascular health. Flexibility and balance exercises. Include stretching and balance exercises such as yoga or tai chi to improve flexibility, coordination, and posture, reducing the risk of falls and related injuries. 3. Managing medical conditions. Monitor blood pressure. Keep track of your blood pressure regularly and work with your healthcare provider to manage hypertension through medication, lifestyle modifications, and stress reduction techniques. Control diabetes. Monitor blood sugar levels closely and adhere to a diabetes management plan that includes medication, diet, exercise, and regular medical checkups to prevent complications and reduce the risk of stroke. Lower cholesterol. Take prescribed cholesterol-lowering medications as directed by your healthcare provider, follow a heart-healthy diet, exercise regularly, and avoid smoking to manage cholesterol levels and reduce the risk of plaque buildup in the arteries. 4. Quitting smoking. Seek support. Utilize resources such as smoking cessation programs, support groups, counseling services, and nicotine replacement therapy to help you quit smoking and overcome nicotine addiction. Avoid triggers. Identify triggers that prompt smoking behavior and develop strategies to avoid or cope with these triggers effectively, such as finding alternative stress relief techniques or engaging in distracting activities. 5. Limiting alcohol intake. Excessive alcohol consumption can raise blood pressure and contribute to other risk factors for stroke. Drink alcohol in moderation or abstain altogether. By incorporating these lifestyle changes into your daily routine, you can significantly reduce your risk of stroke and improve your overall health and well-being. Remember, small steps towards a healthier lifestyle can yield significant long-term benefits in stroke prevention. Early diagnosing a stroke. Recognizing the signs and symptoms of a stroke is crucial for receiving prompt medical attention. The fast mnemonic, face drooping, arm weakness, speech difficulty, time to call emergency services, is a helpful tool for identifying a potential stroke. If someone exhibits these symptoms, it's important to call emergency services immediately. Treating ischemic strokes. Ischemic strokes, which account for the majority of strokes, occur when a blood clot blocks a blood vessel in the brain. Treatment typically involves administering clot-busting medications such as tissue plasminogen activator, TPA, or performing a mechanical thrombectomy to remove the clot and restore blood flow to the brain. Time is of the essence in treating ischemic strokes to minimize brain damage. Treating hemorrhagic strokes. Hemorrhagic strokes occur when a weakened blood vessel ruptures and bleeds into the brain. Treatment may involve surgery to repair the ruptured blood vessel and control bleeding, as well as medications to reduce pressure on the brain. In some cases, supportive care in a hospital setting may be necessary to monitor and manage complications. Remember, strokes are a leading cause of disability and death worldwide, but many are preventable through lifestyle modifications and management of underlying medical conditions. By understanding the risk factors, recognizing the signs of a stroke, and taking swift action, we can reduce the incidence and severity of strokes in our communities. Remember, every step taken today is a step towards a healthier, stroke-free tomorrow.